Mrs. Adesami, didn't you mention that there are some checks in that regard? Health officers, is that what you said?
There are lots of checks, and I think we have to bear in mind that the school feeding program, beyond increasing enrollment, is a social program designed to bring people out of the poverty net, to try to help them not to get beyond the level that they have gone to in poverty. A lot of them don't have a meal a day. A lot of them come to school for that one meal. And so we say we have to scrap it because it is not perfect. There's no country that has a perfect picture. But then we have a program that has put in place measures to move towards perfection in what we're doing and sustainability in what we're doing.
Just last month, the head of the social investment kind of program, the SIP, Mrs. Mary Muwais, addressed the press after a NEC meeting where she had spoken to some state, the state governors and of course the vice president, briefed them on this program. What she told the press was that corruption and racketeering had really decimated the program in many ways, and that there was a need for greater collaboration between some of the security agencies involved, as well as the EFCC, in making sure that the state actors work effectively with the federal actors so that money is not siphoned. What is the truth behind that picture?
The truth behind the picture is this. The social investment program recognized that transparency is a tool potent to fight corruption. And so in designing all our programs, we had designed it. From the moment we designed who the managers will be, who will recruit to pay the beneficiary, who will recruit to provide the meals for the beneficiaries, every process is a transparent process. Each of them gets their monies in their accounts. For accountability, trackability, we need to be able to know where you are, where you live. So the BVN does that for us. We know who is checking your health status. We know where you had your medical fitness test. We know who trained you. We know who went to your house to check. We know who the school health teacher in the school is, who had given us a clearance. And so when we talk about issues around the program that borders on corruption, it has to do with what the framework is, how the framework has been redefined from the faces of those implementing the program. We don't have a third-party recipient on our funding for beneficiaries, for example. If you're a cook in Zamfara, you get your money directly in your account. And so that means you get an alert for the exact amount you need to feed the child.
But what Mr. Way said, in fairness, is that there actually are some what she called gate men who have essentially given some offered loans to it may be a cook or it may be somebody related with the program, a provider of the service, and that some of these gate men, when it's time to now pay back the loan, are taking a piece for themselves in the States. That doesn't really align with what you're saying.
We have 5 programs. It's not just one. And so when you look at it across the 5 programs, where has the framework been redefined? So if you talk about gatemen, for school feeding, we don't have gatemen. We go directly. We deal with the teachers directly. We deal with the cooks directly. We deal with the pupils through their teachers. So for every level, we have someone held accountable for what we do. And because of that accountability process, we could call you up and say, we heard this is going on. We have people who go to the field every day from within the community. Those are the levels of monitoring we have.
One of the reasons why the federal government was quite keen on this program was because they felt that it was going to have an impact on local farmers in that place, and it was also going to have an impact on school enrollment. We're beginning to get testimonies of that from some states, that their enrollment has improved quite a bit. But then there are questions as to, what real impact can we really measure in terms of the farmers in those areas? Can we really measure how that has worked in terms of collaboration? They're talking about fortifying the foods that, for instance, the children are served. Are we saying, how is that really working, with the farmers in connection with the cooks and the children at the receiving end?
Okay, so when the African Union set out to implement the homegrown school feeding program, 2 objectives: increase agric production and ensure that children come to school, increase enrollment. That's the same model we took on. And when we started, we saw immediately, in fact, the second term, that the enrollment had increased. But then we had to look at other structures that will enable the program to be implemented successfully. One is the agric value chain. How do we get farmers to to sell directly to the cooks. Another is job creation amongst the local community. So it's a local community. We're not thinking of the big farmers who sell rice, who export it. We're thinking of the last community farmer who is part of the 80% of the poor farmers in Nigeria. How does he have a market for his produce without having to travel to a big market in town to sell it? How can the cook who lives within that community pick up from the farmer who is our neighbor next door? We've had stories about that. We've had aggregation model where we have larger companies mop up all this produce because of the logistics of distribution, move it to the communities in a hygienic and safe manner. And so the farmers pick up this, take these goods, get them to the cooks through their major aggregators. Some of them buy directly. The vegetables are bought at farm gates. They are cheaper for the cooks because how much are we paying? 70 naira, but it is an aggregated cost. So if you take 70 naira aggregated for 150 pupils, which is the maximum for us, to a farmer who is at the farm gate, you get your produce cheaper.
Which is another question people are asking. I mean, as to really what kind of food can 70 naira provide? You know, even if you're cooking for a lot of people at the same time, you know, in today's Nigeria, taking into cognizance inflation and a number of things, they're wondering if the federal government is really in touch with the real price of product and produce at the grassroots.
Yeah, so we have done an analysis of the food across the 6 geopolitical regions, the market pricing, what we can obtain, and at what cost. Either we get it from the market or from the farm gate. That has been analyzed. We came to 50 naira. Remember, there are children between 6 and 13, primary school, who have not even gotten the meal. It's not the meals we will serve for our own children who are in private, who will get a chicken. Some have never seen an egg for the 6 years they've been on earth. And so one egg on the feeding program will go for 24 naira, but in the open market it's for 34 or 35 naira. And so that is the negotiation the cook and the farmer has to get this done. We have 75,000 cooks, for example, on the school feeding program. Each of them have been included in the financial system. They have a bank account. And then they can also negotiate pricing and have a savings. So they have at least 3 people they are, you know, catering for within their own value chain. They have been able to create jobs for the firewood seller, for the person who brings in water for them to cook. A lot of trickle effects have been seen. And when you talk about the farmer, we'll take just the egg, the Poultry Farmers Association. The time we had egg glut last year, we had to sell out their eggs. They had to bring down the cost of their eggs because they knew that we have to sell it to this program. It's an institutional market, it's a structured market. We know our monies are coming in, so we can trust it.
Let me quickly take you on Mrs. Ogoko's criticism of hygiene, which is, you know, a major point. I mean, one would have expected really that water will be one of the basic things that you would have in the school. For instance, at least for the children to be able to wash their hands before and after meals, for the cooks to be able to maybe take care of the plates the children are going to use. So, I mean, wasn't that really a concern? Even though, you know, there are issues as to whether or not we should build cafeterias before the children can eat, but in terms of basic hygiene, such as washing of hands, shouldn't that also have been taken on board?
Water was a major issue. Well, we have over 60,000 schools, public primary schools in Nigeria. And if we have over 56% of that having sources of water, wells, boreholes built by UNICEF, development partners, water resources, then we can start and then scale up the boreholes and the wash facilities. Others had, it was mandatory for you to have a wash facility in your school. So there are makeshift wash facilities, there are buckets with taps that all the schools have. The children have to wash their hands. They were trained. The teachers were trained, the cooks were trained. If your pupil does not wash the hand, you don't give them a food. And that's one of the reasons we don't allow them to eat with their hands. That's the framework. We don't want the children to eat, go to the field, play, come back, and then say, we have to put our hands in the food. There must be a cutlery. We don't serve bolus foods where, because I'm used to eating it in my home, I will come back to school, wash my hands, and just throw it in my mouth. No, it's not allowed. So those are the frameworks that have been put in place because of what we had seen.